Good evening, sir.
Good evening, Andy.
Good evening, sir.
Yeah, good evening. Okay. Can you hear me?
Yes, sir.
Yes, sir.
Sir.
Okay. So, as you can see, we are in this third stage. In third stage, we discussed possible strategies, how to help client develop positive strategies or identify positive strategies, and from among those possible strategies, how to choose the ones which best fit them. Okay, so that is something that we had seen yesterday. Now we are going to look at implementation of those strategies. Okay, to make a plan to implement those things. So as you can see here, the counseling skills of stage 3, brainstorming, generating different alternatives, like goal setting. We have seen different aspects of goal setting. Okay, and we have seen how to see which goals are relevant, which goals are not relevant, like which are consistent with values, which are effective, which are substantial. All of them we have seen. We have seen much more than what this crave analysis talks about. Okay, and then today probably we are going to see force field analysis. Okay, this force field analysis concept is given by a person named social scientist by name Kurt Lewin. Kurt Lewin, K-U-R-T, Kurt Lewin. Okay, so we are basically looking at these things right now. Plans. So help clients turn strategies into realistic plan. Okay, what should my campaign for constructive change look like? What do I need to do first, second, and when should I start? Okay. So basically, to understand, first of all, we need to understand what is plan. Like we all make plans. Okay. So what are the components of a plan? So it's good to understand what are the components of a plan. So in order to help clients, it's important to understand what is plan and what is the importance of having plan. See, some clients know what they want and they can also make plan to get there. But again, as in any case of any field, there are different kinds of people, different kinds of clients. But some clients would need more support. So as a counselor, it is important to recognize what is plan, what are the components of plan, importance of plan, and how we can help clients to develop a plan which is viable. Okay. So the plans can be small plans can be little plans. plans can be big plans as well. So first of all, what is a plan? Okay. What are the components of a plan? So basically, a plan, a formal plan involves taking strategies for achieving goals and breaking these strategies into manageable steps. Okay. A complex strategy into manageable steps and organizing these steps in sequence. Like, what should I do first? What should I do next? Okay. First, second, third, fourth. So in a sequence, and also assigning a timetable for completing each step. When am I going to complete first? When am I going to complete next step? So you're basically clearly laying out the path to execute the strategies. So do you think having a plan, having a clear path to what I should do first, what I should do next, it helps clients or not? So it helps clients. It helps clients in many ways. Okay. So we can see what are the different ways in which it helps clients. So that's what we are going to look at in the next slide. That is advantages of having a plan. So basically, first and foremost, plans help clients develop needed discipline. Okay. So because many clients get into trouble in the first place because they lack discipline. So planning places reasonable demands on clients to develop discipline. Okay. So the moment you have a plan, you have something to do. It creates some kind of a push in the person versus you don't have any plan. Okay. So plan helps clients develop needed discipline. And in planning, we divide a big complex step into manageable steps. Okay. That means what does planning do? Plans help clients be overwhelmed. Okay. Because plans keep the steps toward accomplishing the goal small size, bite size. Okay. And then the next thing is formulating plans helps clients search for more useful ways of accomplishing goals, that is, even better strategies. As you are developing, as you are probably dividing that into various steps, you might even realize that there are even better strategies than that. Okay, so there is a refinement of or identifying of better strategies can occur at this stage as well. Then plans provide an opportunity to evaluate the realism and adequacy of goals. That is, whether it is realistic or not. Okay, for example, there's this case study that was given in the book, Egan's book. He talks about a manager who lost his job, okay, who was removed from the job. There was also a complaint, a case that was being filed on him. So he is planning to get his job back. That is his goal. But the strategies that he's trying to do is like he's trying to put a case against these people as well, a reverse case against these people. Okay, and he wants to win that counter suit. But again, he discussed with the counselor, and he realized that probably it is not realistic. So he withdrew the suit. Then he decided that alternative goals would be probably let me first get into a better shape shape in the sense to be in a better place so that I can find a better job or a good job. Also, probably go to the manager and discuss with him in a different manner rather than trying to fight against him. So he realized during the development of a plan, probably they are not viable, which resulted in changing those steps into different steps. Okay. And then plans make clients aware of resources that they will need to implement their strategies. So this is very, very important. Like a mother who lost her younger son and she became completely withdrawn from social life, not taking care of herself. And during a counseling session, she realized that she lacked the social support needed to carry out the plan. Okay. To bring herself back into the community. So then she found out that she need to again reach out to her friends, even relatives, because if she had to get back into the community, that is what she can do. So she has to pull out those resources. Here resources are social support. Okay. Then formulating plans helps client uncover anticipated obstacles to accomplishment of goals. Okay. Again, there was a case given in Egan's book. He talks about a lady who is coming from a different country who escaped or absconded from different country and came to US and she wants to get settled there. Okay. So there are different options that she has, like she can seek political asylum or she can get married to somebody like who is a US citizen. Okay, so that she can get that green card and all those things, or she can develop enough skills, because if they want to give you some visa or something, you should be able to show that you are competent enough. You will be able to contribute to. So these are the options that they have come up with. But in every option, there is a possibility that it might not work out. Okay, so as you discuss the plan, the steps, you will also uncover what are the obstacles that might come in the way so that you can address them. You can develop a plan B. Okay. So developing a plan has these many advantages. So which makes it like if the client has a plan, they are more likely to succeed in achieving goals or engaging in goal accomplishing actions than when they are not having a plan. Okay, that is what the importance of plan is. Then plans need shape to drive an action. So basically, shape is basically involves, it identifies what are the activities, actions needed to accomplish goal or a sub goal. And again, all these activities are put in a logical context or logical or flexible order, and then sets a time frame for accomplishment of each of those key steps. So basically, this addresses three simple questions. Okay. Those questions are, what are the concrete things that need to be done to accomplish the goal or the sub goal? In what sequence should these be done? What should be done first? What second? What third? Okay. What is the time frame? What should be done today, tomorrow, next month? Okay. So basically, in the plan, we have sub goals. We have time frame for each of those sub goals or sub steps, and we know what is the order in which we need to engage in those actions. So there are two cases that I've presented here. So I'm just reading, and I want you to focus on this planning aspects in these cases. Okay. Harriet, an undergraduate student at a small university, wants to become a counselor. Although the university offers no formal program in counseling psychology, with the help of an advisor, she identifies several undergraduate courses that would provide some of the foundations for degree in counseling. One is called social problem solving skills. A second, effective interpersonal communication skills. Third, developmental psychology. the developmental tasks of the developmental tasks of late adolescence and early adulthood. These are the three courses that she found. And Harriet takes the courses as they come up. Unfortunately, social problem solving skills is the first course. The good news is that it includes a great deal of practice in the skills. The bad news is that it assumes competence in interpersonal communication skills. Okay, before you take that course, it assumes that you already developed those interpersonal communication skills. Too late, she realizes that she is taking the course out of optimal sequence. That was not the right sequence. She should have first taken some course on interpersonal skills. Then she should have taken problem solving skills. Okay, but she realized it late. Okay, she would be getting much more from the courses had she taken the communication skills course first. Okay. Harriet also volunteers for the Dormitory Peer Helper program run by the Center for Student Services. The center's counselors are very careful in choosing people for the program, but they don't offer much training. It is learn as you go approach. Harriet realizes that the developmental psychology course would have helped her enormously in this program. It would have helped her understand both herself and her peers better. She finally realizes that she needs a better plan. Okay. So in the next semester, she drops out of the peer counselor program. She sits down with one of the center psychologists, reviews the school's offerings with him, determines which courses will help her most, and determines the proper sequence of these courses. He also suggests a couple of courses she could take in a local community college. Harriet's opportunity development program would have been much more efficient had it been better shaped in the first place. Okay, so it shows the importance of the sequence, right, in reaching your goal. The next case is a case of a person whose name is Bernard, who wants to become a leader, and Bernard decides to reset his managerial style with his subordinates by involving them more in decision making. He wants to listen more, set work objectives through dialogue with them, ask subordinates for suggestions, and delegate more. He knows he should coach his direct reports in keeping with their individual needs, give them feedback on the quality of their work, recognize their contributions, and reward them for achieving results beyond their objectives. So now let's see how he sequences them. In what sequence should Bernard do these things? Bernard decides that the first thing he will do is call in each subordinate and ask, what do you need from me to get your job done? How can I add value to your work? And what management style on my part would help you most? Their dialogue around these issues will help him tailor his supervisory interventions to the needs of each of the team member. Like without identifying the needs, like if he's trying to change, probably it would not suit those people. So the logical first step would be to analyze their needs. The second step is also clear. The planning cycle for the business year is about to begin, and each team member needs to know what his or her objectives are. It is a perfect time to begin setting objectives through dialogue rather than simply assigning them. Okay. Bernard therefore sends a memo to each of his direct reports, asking them to review the company strategy and business plan and the strategy and plan for each of their functions, and to write down what they think their key managerial objectives for the coming year should be. He asked them to include stretch goals. That is not just what they are doing, but go beyond those goals. So what is Bernard's time frame? Bernard calls each of his subordinates immediately to discuss what they need from him. He completes his objective setting sessions with them within next 3 weeks. He puts off further action on delegation until he gets a better reading on their performance. So this is a rough idea of what a plan for Bernard might have looked like and how it might have improved his chaotic and abortive effort to change his managerial style. So on the condition that he was convinced that a different approach to management and supervision made personal and business sense. So he would only engage in this particular action only if he gets convinced that this particular or new one is better than what he had already been following. Okay. So it just to show how the planning is done and the importance of sequencing and dividing strategies into simple steps. Okay. As in case of all other skills, there are some questions as a counselor you can ask yourself. You can use these questions to help the client to develop planning. So it's given here. Which sequence of actions will get me to my goal? Which actions are most critical? How important it is the order in which these actions take place? What is the best time frame for each action? Which step of the program needs sub-steps? How can I build informality and flexibility into my plan? How do I gather resources, including social support, needed to implement the plan? Okay, so you don't have to, again, as I said in the last class as well, that you don't have to show this list and ask the question, ask the client to answer these things, but keep this in mind. And in your discussion, understand whether the client is taking these things into consideration. If the client is not taking, then use these questions as probes to bring those things from the client. Okay. So next is how can we make this happen? How can we make them implement? Okay. So before that, we will see according to Tom Morris, there are certain conditions which must be present to achieve success. So I'm just presenting these conditions that are given by him based on his research. So basically having a clarity of what you want, that is goal. Then focus and concentration in preparing and planning. And self-efficacy that we had already discussed. Okay. Then commitment to emotional energy. This is very, very important. It is the emotion, like you need to persist in spite of the difficulties. Basically, I would say the tenacity part, being consistent and persistent in the pursuit of the goal, and the kind of integrity that inspires trust and gets people pulling for you. And also, it's not seeing the process as very aversive or cumbersome, but to be able to enjoy the process of getting or reaching your goals. So a capacity to enjoy the process of getting there. So all these conditions must be present. And I think Egan's model incorporates almost all these elements at various stages. We try to build all these elements and ensure that clients develop these things. Okay. So what are the principles of effective implementation? Okay. So before that, we need to understand we cannot assume that every client is ready for action. Okay. Some may be more ready, some may be less ready. So we cannot treat all patients as though they are in action. Okay. So I think a researcher by name Prochaska and Norcross, I think they have identified this particular aspect in their research, and they say that beware treating all patients as though they are in action, because most arrive not being ready for the action. But the research says, like, the sooner the clients begin to act, the better would be their chances of succeeding. Okay, so that means you should be able to balance both of them. You cannot push them too hard as well without understanding their readiness. Just because if they start early that they would succeed, that's why you cannot push, because if they are not ready, eventually they are going to fail and it would not help them. So this causes a dilemma, because the sooner client begin to act on their own behalf, the more likely they are succeed. So this is the dilemma. So basically, the counselor's job is to help clients bridge this gap. Okay. Like develop that readiness. At the same time, you try to see they will get into action as soon as possible. But consider both of them. They cannot delay too much as well, because the research shows the quicker they are getting into action, they are more likely to succeed. So progress in therapy is often accumulation of small changes and sometimes plateaus, sometimes regressions. So patience on the part of both client and helper is essential. Okay, so it is, you need to have this kind of an attitude where you can be patient enough when the client is not ready, when they are experiencing a plateau, when they are showing some kind of a dip. So they are all part and parcel of this change process. Okay. So in order to implement effectively, along with the strategy, we need to have two other things. Okay. Strategy needs to be complemented by tactics and logistics. Okay. What are these tactics and logistics? So a strategy is a practical plan or program to accomplish some objective. Whereas tactics is the art of adapting a plan to the immediate situation. This includes being able to change the plan on the spot to handle unforeseen complications. Okay. And whereas logistics is the art of being able to provide the resources needed for the implementation of a plan in a timely way. So again, to give an example, in Egan's book, again, he talks about a girl who wanted to uh, uh, like, in order to reduce her course load in a year, even in summer, she wanted to do a course. Okay. So in order to do that course in summer, they have to pay the fees beforehand. But she is not capable of paying the fees beforehand because she wanted to work in summer and earn money and then pay later. But the course would not uh, uh, give that opportunity to her. So what she does is she finds out that there is a community college nearby in the town where she is living, where the same course is offered, but for a lesser price, right? So now what she is doing is her overall plan strategy is same. Okay. But in the light of unforeseen circumstances, that is because of the demand for payment, she is adapting a new plan. That is a tactic. Okay. And also she is able to locate another resource. Okay. She can work in summer and she can pay it later. So that flexibility is very, very important. Is it clear? Tactic and logistic. My willingness to adapt the plan to immediate situation. Okay. And also to be able to provide resources in a timely way. So many well-meaning and motivated clients are simply not good tacticians and are not good at finding the resources that they need. So means this model of Egan goes into so much detail, because if these things are not, if we are not aware of them, they are more likely to fail. Okay. So when you take a client through this whole process of counseling, they will actually become counselors themselves, because they know how to help themselves in the future as well. Right? They don't have to depend on us always, because they know all the processes that are involved in helping themselves. And that confidence they will only get if they succeed. If they don't succeed, they won't get that confidence again. They might say, I had put in so much of work, but it still didn't work out. I don't think this is useful. So basically what we are doing is we are adding value by taking them through these things. Okay. So principles for humanizing the mechanics of constructive change. Basically, humanizing means it looks like it's kind of a mechanical process, step-by-step process. It is so formal, you have to follow all those things. So in order to make sure that it doesn't feel like it, we don't give that impression, we need to ensure few things. That it is so mechanical, the person is lost. Okay, you are just focusing on following the steps, but you are not taking the person into consideration, right? So, like in order to not give that impression, in order to help them see it as an organic process, which is naturally developing, you need to do certain things. Okay. First thing is build a planning mentality into the helping process right from the start. Okay. So what does that mean? Even when the client is talking about his story from the beginning, you start focusing on what are the strategies that you probably this client can engage. Okay. And you also can ask the client, till now, what have you done in order to address the identified issue? Right? So slowly you are actually bringing in that mentality of moving towards a goal, moving towards a change. So helpers need to see clients as their self-healing agents. They're capable of changing their lives, not just as individuals who are buried in the problem situations. Okay. Even while listening to a client story, as a helper, we need to begin thinking of how the situation can be remedied, and through probes find out what approaches to change clients are thinking about from the beginning, no matter how tentative these ideas might be. Okay. So you are bringing in this idea of change from the beginning. Okay, ideas doing something about the problem situation. So you can also ask, what kind of things have you done so far to try to cope with the problem? Okay. So constructive change scenarios like this must be in the helper's mind from the start, not as a preset programs that you are going to impose them on the clients, but as a part of constructive change mentality. So nothing you are going to impose, but it is good to have an idea. Okay. And also it is very, very important not only have this mentality, but you need to adapt this process to the style of client. Okay. That is, some clients want a complete like structure, each step. Some clients are they don't want that complete structure. They want some flexibility to be built in. Okay, where they can also make choices and make changes. So you need to see what clients want, what are they comfortable with. So you need to focus on how specific do the activities going to be, or do the activities have to be, and how rigid does the order have to be. Okay, and how soon does each activity have to be carried out. So you need to see like what is their style. If they are so structure oriented, probably you will specify clearly, probably you will be more rigid about the order, and again, you will also be clear about the time frame that they need to carry out these actions in. Okay. And help clients develop contingency plans. What do you understand by contingency plans? The meaning?
All of a sudden something comes which we have to face or
Yeah, so you need to
keep
have
up.
plan B, basically, an alternative plan.
Sudden and situations.
Yes, unexpected situations.
Correct.
And because, see, this uncertainty is part and parcel of life, right? So if you are going with only one plan, then, I mean, they get stuck. If that is not working out, they don't know what to do. Okay. So since the future is uncertain, it is good to have broad range of options open. Okay. There is no use of investing a great deal of time and energy in a goal or in a program to accomplish a goal that will have to be eventually changed because the world is going to change. Okay. So the client says to herself, if there is a contingency plan, I will stick with this goal until I see that it is no longer viable or until a better goal emerges. Okay. So basically, backup plans provide freedom and flexibility. They also keep clients from falling into the status quo decision making trap discussed in the past. Okay. Then I think probably you also need to know about little bit about ready-made action programs. They are called evidence-based therapies or evidence-based programs. Like for example, for phobia, for anxiety disorders, like for social anxiety, for panic disorder, for what else? OCD. There are some specific protocols that were developed. They outline step by step or session by session things that you need to do with the client. Okay. So what is the use of them in the process of counseling? Okay. So one thing that Egan suggests is it is good to be aware of these things, existing things. You can incorporate them, integrate them into your process wherever it is required. Some specific understanding of these techniques is required. Okay. And they are called again evidence-based therapies or evidence-supported therapies. And there is also something called recently this term came into existence, which is called trans-diagnostic therapies. That is, irrespective of the diagnosis, if you provide these common components, it will address all the issues. Okay. So, for example, one trans-diagnostic approach is focuses on self-esteem. Okay. That is, it proposes that most of the anxiety disorders, they have an underlying cause called issues in self-esteem. So if I address self-esteem, it will take care of the rest of the things. So transdiagnostic approaches, they focus on common factors which are across illnesses, common underlying themes. Okay. So being aware of some of them helps. Okay. Did we discuss this, what do you call, what works in therapy? I think I might have shown you a diagram when we were talking about core conditions of change or core conditions in therapy. Do you all remember that? Like, what is the contribution of relationship to the change? What is the contribution of client's expectancy to the change? Extra therapeutic factors to the change. In one of the first session, I've shown you a pie diagram. Do you all remember that?
Yes, sir. Yes, sir. It is a circle and portions of it,
Yes.
40%, 30%, something
Yeah.
like that.
In that, the technique contributes to 15%. You remember? The
Yes,
technique.
sir.
So if you know these things, probably you can also involve those 15% as well. These ready-made action programs will give you a knowledge of those specific techniques. Okay. So that's where I wanted to link this to that particular diagram. Okay. So again, there are some clients, see, basically many clients, so some clients would say, even before I start therapy, even when we were exploring the issues, they say, I know this, I know this, I know this, I know this. Okay. But there is no doing part. So there is a gap between knowing and doing. Okay. So this is one of the important issues that we need to understand, because procrastination is the biggest issue that you see in a lot of clients. Okay. There are various reasons for procrastination. So you need to help clients overcome procrastination. Okay. Understand little bit more about procrastination. Okay. So one of the factor in the research that talks about why people engage in procrastination is it is because of discomfort intolerance. Okay. Discomfort intolerance. I don't want to anything that feels little aversive, I would avoid it. Okay. So the research shows if let's say if you give 10 tasks to a procrastinator and same 10 tasks to somebody who is not procrastinating, who is not a procrastinator, okay, a procrastinator or somebody who is struggling with procrastination is more likely to do easiest task first, whereas somebody who is not struggling with procrastination is more likely to do the difficult task first. Okay, which shows the mindset of procrastinator. So procrastinator tries to focus on how he is feeling right now than how he will feel later. So they are temporary focus. Temporarily they want to feel good. They're not going to look at how they are going to feel little later. And there are a lot of other factors also, like perfectionists are prone to procrastination, and fear of failure is prone to procrastination. Okay, and people who struggle with procrastination, they lack something called healthy sense of urgency. Okay, so it is important to understand all those factors and see what is happening in your client's case and help the client to overcome that. In some cases, procrastination itself is the big issue. Even like people come because they are procrastinating and they want to address their procrastination. So it is good to know a little bit more about procrastination. Okay. So, and also help clients avoid imprudent action. Okay. So basically, imprudent is it's like you're not thinking through, you're not honest enough. You're just doing whatever comes to your mind. Whatever the first strategy that comes to mind, you're doing it. You're not thinking whether it is realistic. So helping clients not to engage in this imprudent action. And I think one particular technique that I mentioned in the beginning was force field analysis, right? So force field analysis is basically helping clients identify possible obstacles and resources for implementing plans. Okay. If you all have your mobiles available, you can just type in your Google, just type force field analysis once.
Pardon, sir?
In your Google, you just type force field analysis.
Force field.
Force field analysis.
Okay.
Can you see this?
Yes, sir.
Another simple one is this. So there are driving forces, there are restraining forces.
Restraining forces.
There are obstacles, there are facilitating forces. So basically, even before you engage in a action, force field analysis says, based on your past experience, you identify what are the obstacles that might come up. Okay, what factors can facilitate that particular action. Okay, like for example, again, obstacles can be internal, obstacles can be external. Okay, internal obstacle is you get that craving to eat. Let's say you want to diet and you get that craving to eat. So how do you address that? So when you know the obstacles that might come beforehand, it's like forewarned is forearmed. Okay, if you know beforehand, you can be ready. You are not taken by surprise. So you will also make, so okay, I know that this thought might come up. Okay, I know that this thing might come up. So I will also prepare a plan beforehand. It's like implementation intention. Do you all remember implementation intention?
Yes.
When X happens, I would respond with this particular Y response, right? So that you are saying to yourself even before X has actually occurred. So you are preparing yourself for that. Same way, in force field analysis, you will identify obstacles and facilitating forces. So help clients find incentives and rewards for sustained action. Help them see that they are moving towards the goal. They are experiencing successes. Okay, which could involve giving feedback to them on a regular basis. Okay, and help clients develop action-focused self-contracts. I think, again, self-contracts also something that we had already spoken about. Okay, that they are developing contracts with themselves. Determination that I'm going to do this. And social support and importance of challenge. Okay, social support is basically involving family members or involving your friends, letting them know that you're doing this. Okay, and if they can track and if they can help you reinforce and all those things, that would really help. But again, it has to be balanced with challenging from them as well. When they notice that he is not probably following through what he committed to, then as a family member, you should also challenge. So need to find some people who can do that. So that's why challenging relationships is also, honestly, challenging relationships also required. Okay, where there is a feedback, okay, corrective feedback from them. Okay, again, when I said feedback, again, there is a two-way feedback. The feedback can be within session where you can continuously let the client know how far they are, how are they moving, or whether they are doing well towards moving the goal. And feedback can be from significant others. Okay. And feedback also can be confirmatory. What is confirmatory feedback? Letting the client know you're doing well, you're on the right path. Okay. Corrective is and helping the client to see what aspects that he can change. Okay. Again, it is very important to know how to give corrective feedback. So there are some steps in corrective feedback. So give feedback in the spirit of caring. Okay, you are not in the spirit of what you call judging the client. So it is coming from the spirit of caring. Remember that mistakes are opportunities for growth. A counselor, we need to remember that. Use a mix of both confirmatory and corrective feedback. Be concrete, specific, brief, and to the point. Focus on the client's behavior rather than more elusive personality characteristic. So this is something that we should not do. Like, for example, what is the difference between behavior and characteristic? Like if you are focusing on the behavior, you say that day you lied, okay? And behavior, like personality characteristic is you say you are a liar, okay? So you focus on the behaviors, not on the personality characteristic, because personality characteristics means I cannot do anything about. Behaviors can be changed. Help clients see whether their behavior is helping or hindering goal accomplishment. Help clients explore the impact and implications of the behavior that they are engaging in. So avoid negative language arising from impatience. Okay, don't use that kind of a language. Provide feedback in moderate doses. Don't overwhelm the clients. Engage the clients in a dialogue. Invite the client not only to comment on the feedback, but also expand it. So don't lecture the client. Help the client discover alternative ways of doing things. If necessary, make suggestions. Help clients explore the upside of changing and the downside of not changing. Okay. So all these things are to be taken into consideration. Again, what are the questions that are present to? These questions are again given in Egan's book. So you can, as a counselor, we need to be aware of these things when helping them in developing a plan. So now that I have a plan, how do I move into action? What kind of self-starter am I? How can I improve? What obstacles lie in my way, which are critical? How can I manage these obstacles? Those kind of questions can be asked. Again, as in case of any other skill, there is a shadow side of implementing change. One of the basic thing, according to the research, is its own, what do you call, clients' unwillingness to move towards action. That is helpers' unwillingness to move towards actions. Helpers, they themselves do not have an action mentality. Okay. So as we had discussed, most of the helpers would stop at the exploring and understanding the problems. They don't move beyond that towards action. They don't even move towards change. So this kind of a resistance is even seen in helpers themselves. Okay, that is one shadow side of, and the Egan suggests that one needs to overcome this. Okay. Then you also experience client inertia, like they are unwilling to exert their effort. Okay, like procrastination or unwillingness to like be committed, and I would say two kinds of commitments: initial commitment and ongoing commitment. Okay, so most of the clients would probably start initially well, but they lack this ongoing commitment. So that is one thing. And the other thing is called client entropy. Entropy is basically things over a period of time, they decay. Okay. So same way, many things that are started like our New Year resolutions and all those things, we all start well, but maybe we will follow those things for a month. Then after that, we don't even remember. So many good initiatives are started on a good note, but they are not followed through. So that is one natural phenomenon that is also observed in clients. So we also need to be aware of these factors as well, and make sure that we use some strategies to handle these things as well. Okay. So I think with that I've finished, I guess. Yes. So we finished all the three stages. Okay. I think only one block is left. In tomorrow's class, we'll talk about different uh, like relaxation techniques. Then I think what is there? Psychoeducation, social skills training, assertiveness training, mindfulness, okay, autogenic training. So what are these things and how they can be done, how they are useful is something that probably we will see tomorrow. Okay. And if you have any questions, you can ask me from whatever we had been discussing.
So can I ask a question, sir?
Yes, please.
So I'm Lawrence.
Yeah, can you please switch on your video, even when at least when asking questions, so that I can
Sir,
see your
I am
face.
actually driving. Just a minute, sir. Visible now, sir?
Yes, yes.
Sir. My name is Lawrence, and I have a basic doubt. Uh, your teaching is very great, sir, but at the same time, what is the basic difference between counseling and nowadays the new trend called coaching?
Hmm. Yeah.
That is my doubt, sir.
Okay. See, coaching is where basically counseling is addressing, as you can see, issues.
Yes, sir.
Okay. You have some psychological issue, some distress, you're addressing that. Whereas in coaching, the assumption itself is that you don't have any issues, but you want to improve yourself. You want to make your life better.
Okay.
Okay. See, the client might reach you for coaching, thinking
Yes.
that probably that they don't have an issue, but in the process, you might also recognize that there are issues that they need to also deal with. Okay. But the focus of the coaching is they have some specific goals. They want to improve themselves. They want to achieve those goals.
Okay.
Yeah.
So the other question that I have, sir, is you brought in a lot of insights into the subject, but do we have any? I mean, can we go out and practice anywhere, or do you suggest where we can practice all this, especially counseling per se?
See, I mean, I don't know what is the meaning of this question? Why did you all take this course then?
To learn more about counseling, to have a good hand on counseling, practical is
So,
also required, no, sir?
no. That's what I'm saying. Just
Yes,
to
sir.
learn, or you wanted to practice also when
No,
you
we
this course.
no, we want to practice. That's the reason I asked. Can you suggest a good place where we can go and practice in real terms or real life?
See that again, good. There is no good place as such.
Yes,
You
sir.
need to find. You need to go to a hospital where they
Understand,
can
sir.
recruit you.
Okay, sir.
You need to show your qualifications. If those qualifications are adequate enough, probably they would recruit you.
Okay, sir.
Okay.
Thank you, sir.
You may have to work under somebody or under some supervision initially. Then probably
Yes,
you may start doing on your own as well. But you need to
yes.
see whether whatever the qualifications that we have, are they enough to start practice?
Okay.
But I didn't see you in any of the sessions.
Sir, I am actually traveling from past 15 days. So
Okay.
wherever I get signal, I just put it on, sir, and then I try to listen to your classes, sir.
Sir, I think Mr. Lawrence meant internship, I guess.
Did you mean internship?
Internship and yeah, practice also through internship.
See, practice is something again, you need to have uh, required qualifications to practice. I don't know whether the certificate that you are getting is enough. Okay. Uh,
Okay, sir.
Definitely, if you have some skill practice, it would really help.
Yes, sir. So then a little bit of guidance. In that case, I have done my master's social work with medical and psychiatry as my specialization.
Hmm.
Plus, I've done this course of MSc psychology. Plus, I'm going through this. So, am I eligible for this part of itself for the practice in real time counseling?
See, that's something that again you need to look at those rules and regulations. We don't have any regulatory body as such. Right?
Okay, sir.
Okay. So there is an act, right? A lead Behavioral Health Sciences Act is there. Government
Okay,
Behavioral and
sir.
Health Sciences Act, I guess. So you
Okay.
can probably get into that and see. They have mentioned who are all can practice and all those things. You can also register so that you have some kind of a license or some kind of what do you call uh, credibility, I would say.
Okay.
If you like, get associated with any of these things and you become part of those things, then again we
Okay.
have Hyderabad Psychological Association and all those things. It's
Okay.
good to get into those things, and probably you will know little bit more about how you can practice and all those things.
Thank you, sir. Thanks a lot for your time, sir.
Sir, does this certificate help us to at least assist practicing psychologist?
We don't have actually any rules and regulations. Okay, right now there's no regulatory body as such. Okay, Usually, any PG in psychology is enough to start practicing counseling. Okay. So if you have that, you can see ultimately your skill is something that will get you place. If you can show some skill wherever you go, they will be happy to take you.
Sir, are you working for any organization or you have your own setup?
I am working as a consultant in Hope Trust. Okay, which is in Banjara Hills.
Do they give internships, sir?
Yeah, they have internships. But I don't take any classes in that internship. But they have they've been organizing this internship, I think, for the last 7-8 years.
Okay. With our MSc psychology, can we approach?
Yes,
them?
yes, anybody can approach.
Okay, sir.
And many mental health or counseling centers or clinics, they are providing opportunity for internship. Wherever the psychiatrists and clinical psychologists are there, you will get an opportunity to do internship.
Can we reach you in future, sir, with the certificate for any guidance or help?
Yeah, you can. Yeah, sure.
Thank you, sir.
So can you please repeat the organization name which you are working for? This is
Hope Trust.
Oak, O-A-K.
HOPE, Hope.
Ocha, Hope. Oh, I'm sorry. Okay. Hope Trust. Okay, sir. Thank
Yeah,
you.
if any other things we can discuss tomorrow, I think it's gonna get cut now.
Yes.
Yes, sir. Tomorrow we really need a good closure.
Sure, definitely.
Yes, sir. Because all the other subjects without closure, they ended the classes.
Yeah.
We had many doubts, but we couldn't ask.
Yeah. So probably it won't take much time. I'll give you enough resources also. I'll give links to enough resources for tomorrow's class because it is
Sir,
about
can you
skills.
please tell me regarding what we are talking about tomorrow?
Tomorrow you have your last block in your coursework is left. That's what we are going to discuss.
And we don't have books, sir. Can you please?
You didn't take books. You don't have none of you have books.
No, sir. No one is having. They're not.
No, sir, they have books.
But everyone has PDFs, sir.
Yeah, PDFs are available, right?